Hello everybody, this is Dr. Rehab Director here. Thank you so much for checking out another video. Today we're going to talk about how to critique or how to choose a skilled nursing facility for yourself or for a loved one. Working as an occupational therapist in various long-term care and inpatient rehab facilities, people always want to ask, especially going from inpatient rehab or any setting to a long-term care facility, how do they choose which one to go to? I mean, there's lots of choices. Um, Most of the time, it's not something people want to do. I mean, who wants to go live in a nursing home? That's usually what family members are thinking or patients are thinking. There's certain stigma associated with it, and one thing I'd have to say is that if you do your homework, there's a lot of good places out there that are going to be a good short-term place or even a good lifetime place for you or for your loved one if that needs to be the decision that will have to be made. And I'm hoping that with this video I can give you some ideas as to things to look for. Obviously this is not a all end all kind of information, but it's going to give you a good idea what to look for, a good starting point to making that decision. In general, I mean, there's certain things people think about nursing homes that are not necessarily true. And, some of the things that people think like, oh, there's not going to be anything to do, or the person's going to be in bed all day, and they're going to be forgotten, they're going to be lost. And no, if you find the right nursing home, it's going to be a great place with great staff and, hopefully a good amount of activities to do so that depending on what the needs of you or your loved one are, they'll be engaged. So, speaking of needs, who needs to go to a nursing home? What conditions or what kind of help will the person need to, really go to a nursing home? Because there are other options as well. If you follow the continuum of care, following, some sort of hospitalization. Somebody goes to the ER for whatever reason. They had a stroke, they broke their hip, they had a hip replacement, knee replacement, what have you. There's a certain amount of help that they're going to need. Some of this is going to be short term, some of this may be long term. That means that this is going to be the amount of help that they're going to need over time. Usually in a hospitalization, it's a very short time. We call that acute care. The medical team is there stabilizing, trying to figure out what needs to be done to correct whatever happened or to fix whatever happened. And then after that, the person might be 100%. They're going home, right? They're going back to their family, back to their routine. But maybe sometimes people need a little bit of time to get better, or they're going to need a lot of time to get better, or they might not get better. So in a case that they're doing somewhat well, probably can go home. They're gonna go to home with home help, home with outpatient help, follow-ups and so forth. Maybe it's more of a permanent thing, and they go to maybe an inpatient rehab hospital, try to see if they can build up, and then from there they go outpatient or home health, or from there they go to assisted living or personal care, or a skilled nursing facility. Usually if the person's progressing or going down a track where they're gonna end up not being able to go home, they're gonna go from, if they need therapy for example, they're gonna go from the hospital maybe to an inpatient rehab facility, then maybe to a skilled nursing facility. And then from there, maybe they end up staying there because they need so much help, or they, from the skilled nursing facility, they go back to the community, maybe under personal care, assisted living facility, maybe back home at that point. After a couple months, they've built up and they strengthened, or maybe if they had multiple fractures, those fractures have healed and they can return home with some help, whether it's home health or maybe it's a personal or private duty aid, things of that nature. But getting to the nursing home perspective, once you're at that level, what is your need? Usually a person going to a nursing home requires an extensive amount of help throughout their day, both nursing and otherwise, to function throughout their day. So a skilled nursing facility is going to have a nurse around the clock, available 24 hours a day. They're going to have doctors available, but they're not going to be as available as they would be in a hospital. That's one of the things that people kind of are not prepared for. And you're in a hospital, there's doctors everywhere all the time, right? In a skilled nursing facility, depending where you go, and you have to check the rules of the regulations of your state, but in general, most doctors aren't required to be there more than once a month. So this will help you gauge where you want to go too, because there are some places that are going to go right by that tier minimum requirement once a month, and there's some places that will have the doctors in once every 3 days or so. So again, when you're trying to figure out where you want to go, what your needs are, you're going to want something that maybe it's more than once a month, I would say. But you're not going to find probably something where they're there every day. You might, but it'll be a little bit harder or fewer in between. So you want to know what the criteria is, because if you have in your mind, you're looking at a nursing home or different nursing homes, and you want the hospital criteria and the hospital resources, you're not going to find that in a nursing home. It's just a whole different level of care, a different continuum. By the time somebody gets to the nursing home, medically they're much more stable. They're expected to be very stable at that point. So the doctors aren't going to be available as much physically. I mean, they're always going to be on call. There's going to be a nursing director, nursing staff that will reach out to these doctors as needed, and they will come in as needed. Their physician's assistants might come in, or the nurse practitioners will come in if they're not already in-house. Some nursing homes will have PAs and nurse practitioners in-house. Again, those are the kind of things you want to find out. But what are your needs for you or your loved one? If you know that your loved one is going to be there a couple weeks and going back home or going back to the community, then you might be a little bit more flexible as to what you're looking for. If you know this might be the place your loved one or yourself will be there, long term, this is going to be where you'll be till either you move or the rest of your life, then you're going to be a little bit more maybe stringent on what you're looking for. Are you going to need therapy while you're there? Maybe you're going there for antibiotic treatment, a couple weeks, and you're physically doing well. Maybe it's just more of a technical reason why you're going, or you have a certain wound. Do they have wound care that'll take care of that? Or maybe you do need therapy. And most of the time, if somebody's going from the hospital to a skilled nursing facility, most facilities will have therapy available. Most facilities do have therapy services available. But again, what kind of therapy are they getting? And I'll talk about that a little bit later. So first, when you hear the news that you're going to have to make that decision, you're going to want to look up some of the places nearby. First, I think do your research online. You're going to get a lot of good information from there, and that'll help you decide where you actually go and visit. You're going to get a ton of different places to go to. You're not going to have the time to go to every single one. Most of the time you might be pressed for time. These kind of decisions, they usually happen because there's some sort of medical event that occurred. So it's not something you're planning ahead. When you're looking for a nursing home, you're getting maybe a list from social services at the hospital, because you're getting the news that you or your loved one will not be able to go straight home from the hospital, and you're going to need a little bit more time, and you're going to need a little bit more help. So they're going to give you a list, or they're going to give you some resources to go after. So again, usually this type of decision is being done within a matter of days. Sometimes if you're lucky, a week or so, if you're coming out of the hospital. But most of the time, like I said, not much notice. So if you do have a condition, or if your loved one has a condition where you think that this might be something down the line, maybe your loved one has a progressive disease, or a disease that's expected over time to continue to worsen, you might want to look at these things earlier on. But assuming that you're not, don't worry. I'll help you get to the right solution and help you kind of weed your way to the right places. And that's what we're going to next. So, all right, so continuing, if you're trying to find a place, first thing, do all the groundwork you can from home or from your resources without having to physically go to the facility. Look up reviews. Google's a great tool. Look at the reviews by people who have been to these locations, or who are family members of people who are there, or sometimes employees will post some things. Obviously, with any review, just kind of pay attention to what people are complaining about, and make sure it's a worthwhile complaint if there are issues. If somebody's saying, they don't like that chairs are red versus blue, is that something that really matters to you? Probably not, right? If somebody's complaining that, it's taking X amount of time for them to get help when needed, that's something that you might want to consider. And, look at the tone. Sometimes some of those reviews can be, you can see that there's some emotional or secondary reasons behind them. So you have to kind of sort that out. But definitely a good source. If you have multiple reviews, I think the average kind of score outweighs any outliers there, and usually you can get a pretty good idea of what you're looking at. Star reviews are great. All skilled nursing facilities are regulated by the state. At least on a yearly basis, they are. They go through a yearly survey. Based on the outcome of this survey, they will have some deficiencies. Usually, it's not uncommon for a good facility to have a few deficiencies. Anywhere between 1 and 5 is usually acceptable. As you keep getting more and more deficiencies, you have to kind of figure out what's going on. But it's not uncommon for facilities to have more than that. What you really need to look at is what are the deficiencies, what are the problems that they're having, because a facility could have a simple deficiency, something that can be quickly adjusted, to something as easy as maybe a staff member didn't know where the fire extinguisher was. Sometimes staff, they get nervous when they're being audited or asked questions by surveyors. But it can be something a little bit more, in depth, as far as maybe medication not being delivered correctly or at the right time. Maybe not having the right infection control procedures. So those are things you want to look at. But they kind of give you an idea of what's happening in the building. Other thing you want to look at is, what are the rehab staff ratios? What's the nursing staff ratios? What's the size of the building? How many beds do they have? What's their current census? And based on that, how does their staffing reflect what they have? Also, another part that's really important with the staffing is rehab and nursing wise. Are these in-house people? Are they subcontracted? Are they other facilities? Do they have temporary workers because they're not able to retain staff? So you want to look at that. So the attrition and the makeup of the staff. If a building is having a hard time keeping staff members, whether it's nursing or therapy, CNAs, there might be a reason for that. And usually, if it's a negative reason, that's going to trickle down to the care that you or your loved one will be getting compared to other facilities. Sometimes, there's contract staff because it's a seasonal building. It tends to get really busy during certain times of the year. Not usually the case for most facilities. Usually when they have a lot of contract personnel, whether rehab related or nursing related, it's because they're having trouble recruiting. It could be because there's just not a lot of people in the area. And that can happen if you're in more like rural locations. But if it's in a big city or in a major area and they're having trouble recruiting, I try to look and see why people don't want to stay working for them. It can be management, it can be the ratios, it could just be the ethics of it. So again, doesn't mean it's a bad thing. I don't know. I'm not saying that, but definitely something to look at. Now, other things you want to find out is what kind of extras or what kind of services do they provide? Do they have transportation? Do they have things that involve activities, or how many activities do they have throughout the day for the residents during the weekend? Again, what do they have on the weekends versus the weekdays, staffing wise, activity wise? And you want to know that. Do they offer like cable televisions in the rooms? Is there a phone in each room, or is there like a central area where one phone is located for residents to use? Again, there's regulations that dictate what needs to be there, but the level of how they fulfill these regulations vary. So, For example, as an example, yeah, residents are required to have access to a phone to call out if able, but not necessarily something that might be required in every single room. So keep those things in mind. The type of rooms as well. Are they semi-private? Are they private rooms? And if they're semi-private, how many people, how many beds are in a room? It's standard might be 2 rooms, but you will have some facilities that have 3 to 4 beds in one room. And again, it might be an indicator of the quality of care, or the type of services that they're going to be provided at that facility. Um, Visiting hours, when are the residents allowed to be seen by their family, if any? Some places will have open 24 hours a day. Some will have some set hours. Um, Most places are not going to want family members there to sleep in the room, so just be aware of that. I mean, if you're there and you're visiting and you're awake and you're in a chair, it's probably okay. But they're not going to want you to lay down in the bed that's there just because there's no roommate. They're not going to want you to probably have a cot or set up an inflatable bed in the room. There's regulations that prohibit that, so that'll be a common thing. Um, and then once you narrow it down to a few buildings, and you have a pretty good idea of what you're truly considering, the best thing is to go and check it out. I would recommend going unannounced. My personal experience is that if you go, I've worked in very good buildings, and I've worked in buildings that have a fair amount of opportunities. Um, and One of the things I would say, if you go unannounced, you'll get a real picture. Sometimes if you are expected or you have an appointment, it gives time for people to, you know, pretty things up, for lack of better words. So I can say go during the day, go unannounced. You go on a weekend too if you want to see what that's like. Usually in a nursing home, the weekend staff is less. There's less staff. It's more of a skeleton crew, both in therapy and in nursing, and you'll see what's going on there. But go unannounced and look at the appearance, look at the smell, look at does it look clean, does it not? You don't necessarily have a brand new building. That's awesome if it is, but having a brand new building doesn't necessarily equate better service, because again, it's going to come down to the staff that's there, the boots on the ground. So look at the staff, look how they present themselves, look how they carry themselves. If you want to ask somebody a question or two and kind of get information about the facility from a staff member, that'd be great. But there's a lot of things you can look at and observe. The environment itself. Does it look clean? The lighting. Is there a lot of clutter around? Look at the residents that are already there. Do they look clean? Do they look presentable? What kind of residents are they? Do they seem like the more functional, high-level people that can engage, or are they a little bit more dependent? Maybe impaired and unable to communicate or to function with the environment. Again, it just gives you an idea as to depending on the level of care that you need, is a facility going to be able to do that? And also, as you see, people like dressed, and even if somebody is, in a condition where they're totally dependent on staff for everything, positioning, movement, it's important that the staff, keep the residents, for quality of life purposes, well groomed, clean, nicely dressed. So you'll be able to see those things, well positioned as much as possible. You'll be able to get those, see what's going on at that level. Um, and then while you're there, you want to ask the staff that's going to orient you and show you around, so about the questions that you saw online when you did your research on them, the reviews, or when you looked at the star rating. Ask about the deficiencies. Those things are public information, so you'll be able to see what they were tagged on and ask about that. Is that something that happens often, or those details? Ask the staff what they feel, how long they've been there. And if you have any questions or anything that you're not sure about, confirm with it when you get there in real time, and ask specifics. Um, like I mentioned before, ask about the weekend staff, weekend rotations, holidays, uh, those kind of things. Um, it might be something to consider as far as insurance. Different buildings, different locations. Depending what's going on with you or your loved one. You want to talk about insurance. You might be under a skilled stay now because there was a recent hospitalization. What happens when that skilled time comes out? And one thing I'll throw out there is a lot of family members usually misinterpret the availability of the potential coverage for insurance for the actual use of insurance. Like just to throw out something in the air, if under a skilled stay, the resident can have up to 100 days of skilled services if appropriate to do so, and that's sometimes in the defense of the facilities. Is something that the family or the patients sometimes don't understand, that just because it's available doesn't mean that that's what's going to happen, because is it appropriate to do so? I mean, if the person is now, from a therapy standpoint at least, if the person is not benefiting or improving from the services being provided, they do not need the skilled intensity for that reason. We need to justify why the person needs to continue on a skilled therapy being 5 days a week or more. It's more of a terminology issue, because you're not going to get less quality or a different group of therapists if you're not skilled. It's just the intensity. 5 days or more skilled, less than 5, 4 or less would be non-skilled, usually outpatient Medicare B services. So what's going to happen with that? Because it becomes a financial issue, because when somebody's under a skilled stay, room and board are covered. It's like a per diem. It's a bulk billing in a sense, and everything's covered: room and boards and therapy and nursing. But when they're no longer skilled, things are compartmentalized. Usually room and board is one thing, and you may or may not have long-term care insurance. You may or may not have medical assist or Medicaid to cover that kind of stuff. And then therapy is a different thing. You may or may not have Part B services. So it's really important that you're aware that the timeline that they say might be an option might not be the timeline that you're dealing with. And what timeline you're going to be dealing with, you want to talk to your healthcare staff about that. Your doctor who's making the referral to the skilled nursing facility, the receiving doctor, the nursing staff, and the therapy staff. As they do their evaluations, they can give you an idea as to, from a therapy standpoint, how long they think that you or your loved one will need to be on therapy services. And obviously, you want to have those conversations, and it's something you want to have at the forefront. From the healthcare perspective, we say discharge planning starts on day one. So the moment that we're seeing the person, we're thinking about what's the next step, what are the options, and that's how you have to think about it as well. You have to think about it from a realistic point of view. I mean, you understand that. Yes, a person might have been 100% independent before, but look at them how they are today. And yes, we hope that they're going to get better. We hope that these interventions are going to improve the function. But from a discharge planning perspective and from a family perspective, you want to say, okay, worst case scenario, if they're like this today, can they go back home on their own? Or can I afford to pay somebody to help them at home? Or if not, what's the next step from here? Can they go to an assisted living facility or personal care facility? And if the answer is no, and long-term care might be the place where they're going to end up, is this a facility that they will stay in? And that's something you want to consider, because if that's the case, you want to get to that facility early on. You don't want a bunch of transportation or transitions. If you think that there might be a chance that you or your loved one will be in a long-term care facility or staying in a nursing home for long-term care, you want to try and get your services, your therapy in that same facility and transition from day one, in the hopes that if they do stay, that they're more familiar with the building, they are acclimated, and they'll be happier than if you start in one building and then transition to the next. So keep that in mind, that you do want to keep in mind that this might be the final stop, and if so, you want to get to that building as quickly as possible. But obviously, you know, on the positive side is a person comes in and they do better and they can go to a lower level of care from there. And like I said before, I'll talk about those levels of care and those things in other videos. But I just wanted to give you, as a potential family member, consumer, um, you know, some tips on how to try to figure out which skilled nursing facility might be the best for you or your loved one. Again, use the resources that you have. Use the healthcare team that you're currently working with to get that information. Use your contacts that might be working in the healthcare already. Again, my videos are supposed to um, take place of all the information that you'll be getting. These videos are intended to just give you things to think about that you can utilize to ask questions, to make decisions, and to look up the information that you'll need for you or your loved one. Again, this is Dr. Rehab talking to you here. Please make sure to leave me any comments or questions that you might have, or maybe potential future videos that you would like to see me address. Please hit that like button and please subscribe. All right, you have a great day.